Hey there guys, and welcome back to my channel. Today we have a fascinating topic to discuss: blood loss and its critical thresholds. Have you ever wondered how much blood the human body can actually lose before it becomes life-threatening? Well, stick around and watch this video all the way through to the end, because we have all the information you need right here. And please hit that subscribe button as well. So we can bleed from 3 different blood vessels: our arteries, our veins, and our capillaries. If we bleed from our arteries, blood tends to be pumping out. It's normally quite bright red in colour as well. If we bleed from our veins, it kind of flows out, a bit like someone just left the tap on. It's normally quite dark red. And our capillaries ooze or seep with blood. Now, it's important to note that blood loss can occur due to various different reasons. It could be trauma, could be surgery, or also certain medical conditions. And understanding how our body responds to blood loss is crucial in preventing any potential risks. So let's get started then. Because blood is an incredible life-sustaining fluid that carries oxygen, nutrients, and hormones throughout our body, while also helping to remove waste products. On average, a healthy adult has around 10 pints of blood inside our body. And how much blood loss is considered safe, and when does it become life-threatening, is a question I'm going to answer right now for you. Because the amount of blood loss that becomes dangerous does vary depending on various different factors, like a person's overall health, the age, any pre-existing conditions they might have as well. However, in most cases, losing anything above 20% of total blood volume can be life-threatening. So that amounts to approximately 2 pints of blood. Now, if you ever gave blood, you would probably give 1 pint of blood. And even then, if you've given blood, you will know you might still feel a little bit dizzy. Well, let's discuss the signs and symptoms that will occur if you lose 2 pints of blood. And we will call that someone that's suffering from hypovolemic shock. So when blood loss exceeds a certain threshold, the body will enter a state of hypovolemic shock. So that's 2 pints of blood, 20% of its blood loss. And this condition manifests itself through symptoms such as rapid breathing, increased heart rate, low blood pressure, pale skin, confusion, fatigue, and even loss of consciousness. And it's crucial to seek immediate medical attention if anyone experiences these symptoms, and to lay them down and lift their legs up and keep them nice and warm. It's also important not to give them anything to eat or drink, even if they're thirsty. You can moisten the lips, but don't give them anything to eat or drink. Now let's discuss some scenarios where blood loss occurs. For instance, what would happen in a case of a severe injury or trauma? Because in case of a severe injury, it's important to remember that quick action and proper medical care is critical. Emergency medical services should be contacted immediately, as excessive blood loss can lead to organ failure, permanent damage, or in worst case scenarios, even death. So call the emergency medical services as soon as you see someone's got a catastrophic bleed. So what would you do then if you see someone that has a catastrophic bleed, that has lost 20% of their blood, that has got someone that's going into shock? Not only do we need to treat them for shock, but we also need to treat the bleed. And we treat the bleed by putting pressure on there. Now, if pressure is not working, we will then maybe try and pack the wound to try and keep the blood inside. And there are special dressings you can use for that. They're called hemostatic dressings. And there's lots of different companies out there that make different types of dressings that can do this job. Or you can apply a tourniquet. Now, clearly a tourniquet can only be used on a limb. A tourniquet is a bit like a belt. You apply about 5 centimetres above the wound and you secure it in place. And it normally has a bolt in there, like a windlass. And you just twist it and twist it. And what that does, it clamps down on the blood vessels. So it tightens and tightens and tightens and clamps down the blood vessels to stop the bleed. There's a saying, life over limb. A person's life is more important than the loss of that limb. Now, if you do ever tourniquet someone, this should be your last resort, because you can't control the bleed in any other way. And if you don't do this, the person will go into shock, which could lead on to cardiac arrest, death. Now, if you put the tourniquet on, please do record the time you put the tourniquet on.